Our newborn twins recently received a near-fatal overdose of blood-thinning medication, heparin, at Cedars-Sinai Medical Center in Los Angeles. Our 12-day-old infants were mistakenly injected not once but twice over an 8-hour period with a massive overdose of 10,000 units of the anticoagulant drug. Their blood was basically turned to the consistency of water, and they were severely bruised and bleeding out of every place they'd been poked or prodded. And they had made it. It made me feel that they had survived for a reason.
Actor Dennis Quaid is a believer that computerized health systems save lives. In 2007, his newborn twins were the victims of a terrible medical mistake.
About a week after we brought them home from the hospital, they started to develop what turned out to be a staph infection.
Our doctor told us to take them over to Cedars. So they told us that they'd have to, be checked into the hospital and be put on antibiotics.
A series of errors led to a life-threatening mistake.
They got 1,000 times the dose of heparin that they were supposed to get. They were supposed to get 10 units of heparin, and they got 10,000 units of heparin.
Thank God they pulled through. Yeah. They're doing great.
But Dennis Quaid became a man with a mission. He began researching hospital errors, immersing himself in medical journals, even testifying before a congressional committee.
Up to 100,000 patients in the United States alone die in hospitals every year because of medical errors. That's the equivalent of one major airline crash a day, every single day of every year.
So how could information technology have prevented Dennis Quaid's ordeal? Easy. Barcodes.
There is a barcode in every checkout stand in every supermarket in America. Why can't there be one in hospitals?
Since this medical mistake made headline news, Cedars-Sinai has installed a computer barcode system for their medications, helping to eliminate human error. Patient information must be entered into a computer and then checked and rechecked.
This is our med room.
Computers are also tied into automatic dispensing machines.
Well, yeah, these have been in place back when our kids were here. I don't think it could have occurred.
So, Dennis, you said that this was for a reason, and now you're now using the voice of your family to change things.
I think that the reason is to raise public awareness and to get something done about computerized record keeping and barcoding in hospitals that's going to save lives, a lot of lives.